happens to be World Kidney Day, and I'm so delighted to inform you about World Kidney Day, which is celebrated every second Thursday in the month of March. And it started a few years ago with a collaboration between the International Society of Nephrology and International Foundation for Kidney Federations. And that has consistently been something that is celebrated in many parts of the world. And today, we're looking at living well with kidney disease, which is a theme that has been framed to help people who are actually undergoing some form of treatment for kidney disease to know that they are not alone, that the health workers and the carers they have, and everybody wants them to live a healthier life. It's really quite challenging when people have to undergo this form of treatment in form of dialysis or in form of kidney transplantation, and they have to restrict their diet. And you know what? Yes, you're on some restrictions in terms of your diet, in terms of your lifestyle, but you know what? More often than not, we know that it is just something that you have to endure for a while, because ultimately, when someone has had a kidney transplant, they tend to have a less of these restrictions. And it's a far better way to actually manage kidney disease, especially for those who are on dialysis. We know you're having a hard time, especially in our climate where people have to pay out of their pockets. It's quite expensive, and it's not something that is easy to be on a weekly basis. You have to visit the hospital. In developed climes, actually it should be 3 times a week. But many of our people in Nigeria are not able to afford more than once or twice a week dialysis. And that's why it's actually proposed and encouraged that people who are on dialysis, chronic dialysis from end-stage kidney disease, should actually try and get funds and do a transplant, because a transplant, though it's pretty expensive, yes, you're talking about 7, 8, 10 million naira, which you have to bring out at a point in time. But when you look at the cost benefits compared to being on dialysis, that may be costing you between 400 to 500,000 per month, you discover that you save costs on the long run. So this year we're looking at people who are living with kidney disease. And for those of us who don't have kidney disease yet, it's also an encouragement for you to know that you can actually take steps to avert and prevent kidney disease. And those steps will include: check your blood pressure, check your blood sugar, check your cholesterol, check your urine, and do an abdominal scan, do an ECG. By the time you've done all these workups, you'll be able to know how healthy your kidneys are, how healthy your heart is, how healthy your liver is, and at the end of the day, you are able to live a better life. Because if we do screening on a regular basis and we're able to detect these things early enough, then we can take steps to treat them early and prevent. Like the old saying, prevention is always better and cheaper than cure. So when we also look at other things that you need to know what, or other things that you need to do. You need to take time to do exercise. Exercise should be tailored to your lifestyle. So you could do brisk walking, you could do jogging, you could do swimming, you could do cycling, and many other things, like having to stop a few meters to your place of work and make the distance and make the other journey trekking or brisk walking. And you know, all this will add up to your exercise on a daily basis. Then also, we'll also look at the fact that you need to drink water. Water is quite good, and it's something that we advise people, whether you're a patient or you're not, drink enough water. The water enables you to clear the waste products and reduces your risk of having a kidney stone. And then you also need to take fruits and vegetables on a regular basis. On a daily basis, you should. And then those who are smoking, they should avoid smoking. Those who are taking alcohol, they should reduce or stop alcohol completely. And those that do herbal remedies, please and please, it's not the best for you. Do consult your physician and do see a doctor when you're ill and you need health care. I know it's a bit expensive, but when you look at the primary healthcare centers and many of the general hospitals in our clime, more often than not, you hardly have to pay a dime to be able to use those facilities. So go out of your way and use those facilities and make sure you stay healthy, because your family needs you and Nigeria needs you, and the whole world is routing to see what you can produce or what you can add as a value to humanity to make this world we're living in a better place. Thank you very much, and I wish you a happy World Kidney Day.